The case we are focusing on today is about a 17-year-old girl, Odessa, who has been diagnosed with insulin-dependent diabetes. On this day, she gets into her car to run an urgent errand despite her blood sugar level being low. Consequently, her vision blurs and she loses focus and thus crashes the car. Paramedics arrive and treat her with oral glucose for hypoglycemia, and on examination, she has no further injuries. She then informs the paramedics she took her lunchtime insulin but did not eat because of the urgent errand. Odessa refuses transport and states she will wait on scene for a tow truck. Ezra, the paramedic, puts her under an emergency examination authority with the reasoning that if she is left on scene, her blood sugar could drop again and she may become unconscious. According to the Mental Health Act 2016, a mental illness is a condition characterized by a clinically significant disturbance of thought, mood, perception, or memory. Additionally, a similar definition from the DSM-5 can be seen on the screen. So, after defining what mental illness is, it is pertinent that we must define now what mental illness is not, which is now depicted on the screen. Furthermore, issues with people falling into these categories occur due to the stigmatization of mental illness, which is extremely prevalent in modern society.
It is pertinent to distinguish between capacity and mental health illnesses. Capacity is characterized as a transient, dynamic, and fluid state of mind which can be impaired by numerous factors such as alcohol, drugs, certain medical conditions, and severe pain. As capacity can fluctuate, it is circumstantial to the person. Mental capacity ensures that the patient can make their own decisions and is determined when a patient fulfills the following. Impaired decision-making capacity, therefore, is when this criteria is not met. In addition to mental health, there are three important factors to consider. Mental health illnesses can exist independently or coexist with other medical conditions. Behavioural disturbances can be unrelated or caused or exacerbated by mental health conditions, and mental health conditions may or may not impair decision-making capacity. It is plausible that a person with a mental health condition can still fulfill capacity criteria. However, if a patient with a mental health condition has impaired capacity and is an imminent risk to self or others, then a treatment authority can be initiated.
An EEA is a legally binding document which can be used by paramedics, police, or healthcare workers to detain and transport a person against their will if they are believed to be at risk of causing imminent harm to themselves. This is expressed in the law within two separate acts, the Mental Health Act 2016, Section 375, and the Public Health Act 2005, Section 157. Detaining a person against their will in Queensland is a punishable offence under the Criminal Code 1899. So how can it be justified for paramedics to lawfully do this? Paramedics must determine that the patient is at risk of imminent harm and that this is a result of a major mental capacity disturbance, which requires immediate assessment and treatment. These three factors must present together for an EEA to be lawfully justified, and this must be communicated to the patient to their level of understanding. The use of EEAs also raises an ethical issue, as detaining a person against their will is ethically wrong under many models. Ezra would be demonstrating paternalism by placing Odessa under an EEA, as he has the intention of helping her, even if this is against her will. But does this really follow with the bioethical principles of autonomy and beneficence, as he is not respecting her wishes, and what benefit would Odessa receive from this action? It can also be asked, is Ezra, as well as many other paramedics who place patients under EEAs daily, acting under ethical egoism, giving themselves a quick and easy solution to move along patients with a said disturbed mental capacity, rather than spending time on scene to provide appropriate counselling and come to a mutual decision?
Clinically significant disturbance. What does that mean? While there's no definitive definition of clinically significant, as it is a subjective measure, the 4th edition of the DSM was released with clinically significant criteria. To fit these criteria, it was determined that a patient's symptoms must be causing distress or impairment in social, occupational, or other important areas of function. In Odessa's case, other than the accident, there is no clear distress or impairment to her daily life. She had recollection of the events prior to, during, and after the accident, proving her memory was not impaired. She displayed no abnormal affect or mood and did not report experiencing any delusions or hallucinations. Her thought and perception may seem impaired as she knew the risks, yet deemed her errand more important. But is this a clinically significant disturbance? Or could it be in part due to the fact that she is newly diagnosed and not yet adequately educated on the impacts of poorly managed diabetes?
Odessa has already been treated with oral glucose, which successfully improved her condition, and has stated she will wait for the tow truck drivers to arrive, thus reducing the risk of a repeated incident. Therefore, Odessa does not have a disturbed thought process, as she is aware of the risk and has full capacity to make her own decisions. She has an understanding of the nature and effect of decisions about the matter. She freely and voluntarily made a decision about the matter, and effectively communicated this decision in some way. Therefore, in this case, it would be fair to say that Odessa was not suffering from mental disturbances due to hypoglycemia, as her condition improved with the administration of oral glucose, and it is not justifiable to determine she has mental disturbances based on refusal of treatment only.
Since it has been established that Odessa is not suffering a mental illness, the question now stands as to whether her refusal for transport is valid. Case law dictates that an adult of sound mind has the right to choose what shall happen to their body, even if others consider this insensible. When assessing the validity of Odessa's refusal, the QAS employed the Verker framework. Firstly, paramedics must discern whether the decision was voluntary and free from coercion, which in this situation it was. Secondly, Odessa must be informed about her condition, treatment options, and risks and consequences of her refusing transport. It is inferred that Ezra provided information on the consequence of her decision. Odessa's refusal must be relevant and apply to the current situation, which it did. She needs to have the necessary capacity to understand and retain information, weigh up the risks and benefits of refusing transport, and arrive at a clear decision that she can communicate. As Odessa is a minor, the paramedic needs to consider whether she is Gillet competent. Considering she turns 18 and is considered an adult in 10 days, she currently holds a driver's license and can clearly articulate her medical situation, it is reasonable to assume that she is Gillet competent. Therefore, Odessa has capacity and her refusal is valid. The final element within the Verker is advice. It's the paramedic's responsibility to provide Odessa with advice and recommendations to ensure her continued safety. Paramedics should provide thorough advice on the immediate steps Odessa should take to prevent another hypoglycemic attack.
Ezra's decision to place Odessa under an EEA is an unlawful decision, as she does not meet each individual criteria and would demonstrate poor ethical decision-making on his behalf. Therefore, it cannot be justified to deprive Odessa of her liberty. As Odessa's refusal is considered valid, paramedics must use the Verker tool to provide further advice on self-management of her condition. They should also consider contacting Odessa's parents to provide them with information on the events that have occurred. However, it is very clear that the use of an EEA to transport Odessa is clinically, lawfully, and ethically inappropriate in this case.